the live's going up. So.
All right, we are live indeed.
Awesome.
Okay, we'll let people trickle in.
We know we're a few minutes early. That's on purpose. The first time we tried to do this, it took us like 15 minutes for Dr. Roberts and I to get the audio figured out. So now I like going live a few minutes early to make sure it's all working.
Yeah, let's go.
You guys might notice somebody with me today. I got Daisy. Super excited.
I'm Daisy. That's me.
That's her.
Me.
I'm super excited that we have her today because we're going to get to know Miss Daisy a little bit, talk about what she does at the office.
How would I go on the live from here? I don't know why on my phone normally I can do it, but I can't pull it up on here.
Okay, this is on YouTube.
The Instagram one, because that's the questions we couldn't see last time.
Okay.
What do I just?
Yeah, you should be. Let me go.
Technology. It's when I get to the office, if I could do this every day, I would. But on surgery days specifically, I walk in and I hand my phone to Daisy. I don't even want it. And I don't know technology. I'm such a boomer. I hand my phone to Daisy all the time. I'm like, hey, what do you do about this? How do you fix this?
I'm checking to see if it's streaming on all of them.
Yeah. Okay, what is this? Campus.
It does say it says
comments
Facebook through Instagram up there. So.
Destinations.
I mean, it's just a little bit slow.
It definitely should be up already though.
Oh, I think it might just be working now. Let's see. No.
Okay. Oh, we'll get it.
I know it's on all the other ones. I can see it on all the other ones. I just
you see it on like Facebook too?
Yeah, so when I signed in on here, I could see Facebook. So let me double check.
We have a limited time. So we're shooting at the Galindo Studios, which is super exciting. But there's a major UFC fighter. I can't say his name, but a major UFC fighter coming here this afternoon. So if we don't get out of here on time, they're going to punch us in the face. They're going to fight us. You think they'll fight us?
Low key.
I think they'll send people in dinosaur. You know what would be best if you guys had people in dinosaur suits that are like, I'm security, it's time to go.
Why dinosaur suits?
Because it would be funny. That you'll just leave.
That's a good point. I don't know if a UFC fighter is like, it's my time in the octagon. What do they call their fighting place?
I don't know. I'm not a UFC girl.
What is this room? It's my time in the shooting studio. Get out or get a punch in the face.
What's his name? Where's Josh? No, that's not his name. Yeah, it's still not on. So if you want to disconnect it.
Yeah, let's try that.
So this is why it's nice to start these things live a few minutes early.
Big facts.
Check on everything.
Dr. Emett, who's going to take your phone now?
I don't know. It's sitting next to me. It's kind of bizarre. Like, I don't really want to have it.
Yeah, I should probably still
have it. You should have it.
Yeah.
You can have it. We're literally reading the instructions. How to go live with streaming software. Awesome. I don't know. We got the guy that can figure it out, though. That's for sure.
Okay, let's peep.
Check it now.
Come on.
Come on, baby.
Everybody, if there is anybody here yet.
There's not. We're not that cool.
We're not that cool.
Cross your fingers.
It's just us.
Well, that's all I did. So I can't get to you from you. So.
But going live on Insta is that's where most of our followers are. So I think that's like the most important
that's
part.
why he's trying to get that one.
Most important.
Tiffany Terry, rude.
I knew it. I almost said Tiffany's probably there.
I'm so glad Tiffany Terry is here because in 2 weeks, I'm making Tiffany Terry come here and be on the interview.
Yeah.
Making? Actually, that's not the right word. No one's ever made Tiffany Terry do anything in her entire life. You can't make Tiffany. I'm convincing her to come over here. Oh, thanks, Tiff.
There's an
Mostly her.
Okay, so that's working. Looks like.
Oh, she's out of town in 2 weeks. 3 weeks. I don't know. In some weeks, you're going to come over here and shoot it. Well.
Okay, so that works straight from there.
I am here on YouTube. Perfect. Well,
worst case,
we
like, use this as the live for Instagram only, almost more of like for comments and stuff.
That's fine.
And then I can feed you the comments from Instagram and stuff.
Okay.
So we're just getting a few little technology components worked out, but
Oh,
obviously
it's because it has to
we
be
like to
this
go
way.
live
It's 'cause the
every
camera
couple
for
weeks.
This is right here. It's not at the
And
top.
the whole
That's why it's
point is
weird.
just to have an open conversation. So obviously I'm Dr. Emmett from All Out Dental in Las Vegas. We are a 3-on-6
Do it again,
office.
the camera's right
And
here.
what does that mean? That means that we are experts in the 3-on-6 smile restoration procedure. And when I say we are experts, it's because my staff is experts in it too. And that's what I want to talk about next. I have Miss Daisy here. So Daisy, say hi to everybody. There's a few other people on the call. So we have Daisy. Daisy's upside down on Instagram. Nice.
Here, we can use his phone too.
We can use my phone. We'll put it up there.
It's because the iPad has the camera in like a corner instead of a normal spot. So.
Oh. Well, we can set it up on my phone. So what people don't know about Daisy, and this is the honest truth, she is my OG day one. She worked for All Out Dental before All Out Dental was
even an All Out Dental.
It wasn't even a thing. Even before we even knew what we were going to do when we grew up, Daisy had decided that she would be willing to come on board and work at All Out Dental. I actually had a phone call with her one night. I was sitting in my car and I was like, hey, do you really want to take this journey and go to dentistry? She's like, I guess. But tell everybody, what did you know about dentistry before you came and started to work with me? What did you actually know about dentistry?
They clean your teeth and help you keep your teeth.
So let's just go ahead and say pretty much nothing. She
Yeah.
knew nothing about dentistry. She wasn't in dentistry. She didn't have experience with dentistry. And flash forward now, we've worked together for over 4 years. It's a long time.
It is.
I'm sorry.
My owners are people, not dentistry.
Right. So 4 years later, and obviously Daisy is the office manager. She runs the entire office. So she runs everything. So when I say we have the experience with the 3-on-6 procedure and we have experience doing this, it's because we've been through it all together the entire way. So from our very first day doing surgery 4 years ago to now being experts in the 3-on-6 procedure, Daisy knows the answer to most of the questions. So it's fun when you call the office, you'll always get a hold of Daisy or Amelia when you call the office, but most of the time, if you're just calling in, you'll see Daisy. And if you ever come to the office, that's the first face you'll see because Daisy
I'm
sits
sitting right up in the front.
Yeah, at the front desk. So that's who you're going to see. So anyway, I thought it'd be fun to kind of get to know Daisy today for just a few minutes. Is that all right?
Yeah, I guess.
All right. So before you worked in dentistry, what did you do?
You might have forced me into doing this.
I did. I tricked her into this, but she's doing great. You're doing really good.
What did I do before?
Yeah. What did you do before you came into dentistry?
So most recently, before I started doing my job now, I used to do medical transportation. I used to help manage a team of, I don't even remember how many people. It was maybe 15 people.
But you guys like booked the transportation,
yeah,
right?
So people who are either elderly or who have a lot of health problems would call us to get a ride to their appointment. And so I had to talk to a lot of people going to some sad doctor's appointments, some good doctor's appointments, and things like that. I've also worked at a coffee shop. It's actually one of my guilty pleasures. I love a nice fancy espresso machine
Yeah,
with some nice foam. I can make you a good coffee. Not a bartender, but barista style.
It's tough when we would stop at somewhere and get coffee because I'm just like, yeah, give me whatever the number is off the thing. I don't care. And Daisy's always like, I want it this way with this and half of this and mixed with this and this kind of milk and this kind of this and this kind of that. You know way too much when it comes to ordering.
Yeah,
coffee.
I can.
But
If
they're
anybody
good.
needs like a really good Dutch Bros order or a Starbucks
That's
order,
the
I
place,
got you.
Dutch Bros.
Just give me a call. You're waiting to get your teeth worked on. Just give me a call. Be like, I want a coffee right now.
She can help you walk through that. Okay, so you also have lived a lot of life, but you've lived in a lot of places. So you've lived out of the country. Where did you live?
I lived in Italy. It was called Friuli Venezia. It was 45 minutes from Venice, and it's all the way at the top, right by like Austria and Croatia, which I've also been to. But I definitely loved living in Italy. It's way more of a slow pace. It's so chill. You have
Italy
to take
Las Vegas.
Yeah. It goes from like me getting up at like 11 and going to have a coffee, something like a mimosa, it's called a spritz, and a croissant, and then going to work and having a couple of hours to work, to like working all the time. That's just
I'm
The
sorry.
American
We
lifestyle.
can go back.
Nah.
We could go there one day.
I also like having stores that are open 24 hours
Ooh,
and
that's
not
true.
forgetting something and then going to the grocery store and them telling you we're closed because it's something comparable to siesta. I think that's the Mexican version. I actually don't know what the Italian version of it is.
Me neither.
It's been so long.
And then you had a big life event recently. And we're going to get to some of these questions here in just a
You
second.
guys
I
want to see
promise.
the ring? Hold on.
But Daisy just barely had a big life event. What happened in your life?
I got married.
She got married just a couple weeks ago.
Yeah, almost exactly 3 weeks ago tomorrow.
Congratulations.
Oh
That's
my gosh,
amazing.
it goes by so fast.
And you have 2 little fur babies at home.
Mhm.
What are their names?
Jackson, Bruce.
Jackson, Bruce. And they're international travelers, right?
Yeah, I actually got them when I was in Italy. I call them my pompous little dogs. They just prance around like you need to take them back to Italy. They're like, this isn't good enough for me.
That's actually really funny. Okay, so that's a little bit about Daisy, but I am super excited she joined me today because she has answers to lots of questions for patients, and we're going to get to know more about her and what her role is at the office throughout this next hour. So let's go to the first question we have here. Help me, please. I just got my wisdom teeth removed and I'm in pain. Okay, I'm willing to talk about that. So I actually did wisdom teeth extractions for a long time. We had a practice where we just did a lot of wisdom teeth, and I teach wisdom teeth extractions. Some people know that about me. I go to a training course and teach doctors how to do that.
Took all my brother's wisdom teeth out. Every single one of my brothers got their wisdom teeth out.
That's true.
Back,
So you take out lots
back
of
in the
wisdom
good days.
So obviously I wasn't there. I didn't take your wisdom teeth out. I don't know how complex or complicated they were. Wisdom teeth can be anywhere on a scale from pretty simple to really complex. And of course, the more complex the type of extraction it is, the more delayed the pain will be. The more pain you're going to experience, the longer the healing can be. It also makes a difference on the technique that the provider used, what type of technique they used to take your teeth out. It also depends on if they used what type of protocol during your procedure. In all of my procedures, we use something called PRF. We use PRF today in all of my surgeries. So all my 3-on-6 patients get PRF treatment, and that really helps decrease inflammation and swelling and prevents dry socket. But it really depends on how long ago your teeth were taken out and the type of pain you're experiencing. You might be experiencing a dry socket, but this is the best advice I have for anybody who's ever reached out to me and said, hey, I have my wisdom teeth out. I'm having some pain.
Can I guess what it's going to be?
Yeah, go ahead.
Contact the dentist.
That's exactly right. I was going to tell you the very best thing. Contact the provider that took the teeth out and just tell them, listen, hey, I'm having some post-operative pain. You took my teeth out a week ago or 10 days ago, whatever it is. And these are the symptoms I'm experiencing. And any provider who's experienced enough to take out your wisdom teeth is definitely experienced enough to help you manage the post-operative pain and help you keep that under control. So without being there and not being your provider, I can't tell you what you should or shouldn't take for the pain. I haven't read your health history, so I can't give you specifics on what is an option for you to take. I can tell you it's common to have a patient take an anti-inflammatory, to take some pain medicine. Those are all common things, but everybody's situation is so unique, the type of wisdom teeth you had taken out. So my best advice for you, just get in touch with your provider and let them know what you're going through, and I'm sure they have the skill set and ability to help you manage whatever you're dealing with. So
also, I saw we missed a post at the top that looks very important from Daniela. Says Daisy is my favorite. We love her for being so sweet and caring.
Anybody who knows,
you skipped that
I didn't mean to skip it. Anybody who knows Miss Daisy knows that directly applies to you. It's fun when we get our reviews and patients go and leave us Google reviews and stuff, and they always brag about Daisy at the front desk. You help a lot of people, you really do. So this is not surprising to me that somebody thinks you're awesome.
Yeah. Thank you so much, Daniela. That's very sweet. It means a lot because I just love what I do. I'm not sitting here trying to be like, hi, I'm Daisy. I mean, I sound pretty high pitched most of the time, guys, but I just love what I do. I love seeing your guys' faces. I love seeing how happy you guys are when you walk out after Dr. Emett has done all the hard work in surgery. So thank you.
Oh, I get the easy job. I like doing surgery. You have to talk to people at the front desk every day.
I do.
I think that's the
I'm a
hard
really
job.
good talker.
Yeah, you are.
I think I've decided. I'm a really good talker.
You resonate. You can resonate well with somebody super fast. Like within an instant, you guys are like best friends and exchanging information about stuff.
That's because I'm like a 29-year-old with like an 80-year-old brain. Like all my life I've lived, I'm like, oh, I've done that and that. Let's go do this.
That's fair. So let's talk about as answering the phone for patients calling the office for 3-on-6, what do you think the most common question you get? Nothing's off the table because, right, we don't, this is just pure information from All Out Dental. And so I want people to get the facts. So what's the number one question you think you get from patients calling the office?
I have a top 3 questions.
Okay, top 3. Let's have it. Top 3.
It's, am I a candidate?
Okay, so we break each one down individually, or do you want to tell us what all the top 3 are first?
I can give you all the top 3
Okay,
and then we
here
can,
come all the top 3, then we're going to talk about each one. So number 1, am I a candidate?
Yeah.
Okay.
Or how do I know if I'm a candidate?
Okay.
What is the cost?
Okay.
And will insurance cover this?
Okay. I'm going to take number 1. I'm going to take, am I a candidate? I'm going to take half of what is the cost.
Okay.
And then you're going to take all of insurance.
All
so
right.
we each get 1.5 things to talk about.
All right.
Okay. Am I a candidate? If I ask you that on the phone right now, hey, am I a candidate? What do you tell them at the front desk?
I say about 90% of people are candidates for this. Even people that have been told by other providers that this treatment's not possible.
Mhm.
I've seen those same people come into my office and you tell them this is possible. So
I'm thinking of one specifically from Florida. We won't say her name, but came to Las Vegas, was in the chair, right, at an office to get full mouth rehab. The doctor comes in and says, I can't do it. The lady leaves, obviously pretty disappointed.
yeah.
Fast forward like 3 weeks later, and she had surgery at our office.
Yep.
She was absolutely a candidate.
Yeah, so when she flew in, that office had already taken her money, and
that's right.
they had already taken her money, and then they sat her in the chair and were like, "We can't do this, and you don't have enough bone," or lots of reasons why they couldn't do it. She was so mad. She walked out of there and called our office. That call I actually didn't get to take. Our wonderful Amelia Bedelia got to take that phone call, and she said, "I'm so sorry you're going through that. I'm only here for 1 day." So we got her in at the end of the day.
Right.
We stayed late that day, and we did
that.
her records, and she was the happiest. She's the happiest person now.
Yeah. Fast forward. She has a
Fast
beautiful
forward, she's
smile.
got a beautiful smile.
Yeah. Totally candidate. So why is that? The 3-on-6 procedure is guided. So traditionally we would look at an x-ray, and some of these patients don't even get to meet their doctor. They'll meet a treatment coordinator. Then they show up for surgery. And I've talked to some of these doctors and they're like, oh my gosh, I show up to do the case. I've never seen the patient. I've never seen an x-ray. I don't know anything about it. And they walk in the room and look and they go, I can't do this freehand. I can't identify where the bone is going to work. One of the big advantages of 3-on-6 is it's a completely guided surgery. So before we ever have the patient in the chair for surgery, I've actually had an opportunity to plan every single implant, the best angle into the best bone ahead of time. And then when I place the implant, it goes to the exact spot, the exact angle, to the exact depth. Everything's guided. So it opens up our flexibility now. We can help way more people because we have a much more predictable outcome by giving them a guided surgery. So number 1 was mine. Are you a candidate? Daisy's right. Anecdotally, I would say 95% of patients who are candidates for any type of full mouth procedure are also a candidate for a 3-on-6. And why is that significant? Because a 3-on-6 is an FP1. That means you get to keep your gums, and we don't just hack off all of your bone and make way for that big fake prosthetic. So if you are considering full mouth and you are wondering if you're a candidate, 95% of people are. And the only way to find out, though, so that's the other thing. What's the only way to find out? You got to come in and have x-rays, and I need to look in your mouth. I mean, that's 2 simple things. And to make it even easier, do we charge a fee for consultations?
We do not.
We do not. Do we charge a booking fee? Explain that. Because if somebody calls my office and I'm telling them right now, there's no fee for a consultation. I'll give you $450 worth of x-rays and as much time as you need with me and with Tiffany, and there's not a fee for that. So why are you collecting $50?
It's for the patient. It's for themselves. It's not really for us. It's so they mentally are already putting something towards the treatment. They're taking that step to go to the consultation, because there's people in different phases of this. There's people that just started their research that they're not really sure if they actually want to even go into the office. Then you have the people that have been researching for 2 years that are like nervous to go, don't want to commit, but know they need to commit. When you ask for those $50, it makes them think, I am ready for this. I am ready to go change my smile and change my life. So that's really what it's for. It's for you who's watching.
Yeah. And some weeks we'll get so we don't even have any consultation spots available. So people are literally on a wait list, and it's frustrating for the staff. It's frustrating for all of us when somebody schedules a consultation and then just doesn't show up. So putting $50 as a deposit is just a way to have some skin in the game. I don't have a better way to say it. I mean, there's probably some eloquent way to say this, but you're just saying, hey, I'm about to take all this time from a doctor and his staff and everybody, so I'm going to put a little bit into this to come, to make sure I show up for my appointment. Now, if they're not a candidate, what would I do with their $50?
Refund.
I'd give it back to them. If they don't want surgery or they don't want to do it, what would I do with their $50?
Here's your $50.
I'd give it back to them. If they do want surgery and want to proceed, we just credit it towards their treatment, right? Guys, I'm not in it for your $50. I don't care. It's all about making sure you show up for your appointment. So, So free consultations. Are you a candidate? Only way to find out, come in, have a free consultation, find out if you're a candidate. Okay, question number 2. What was it? Cost. How much does it cost? All right. I'm going to tell you, I used to say it this way. I used to say the price starts at $55,000 and goes down from there. That's confusing. And Daisy didn't like it when I say that. She actually,
I'm like, how does it start and then go down?
She called me out on that multiple times.
Down?
Listen, a lot of so every single patient situation is different. Always. We've never had 2 identical patients. So some patients need ridge augmentation. They need extensive bone grafting. They might need sinus lifts. We've had many patients that need sinus lifts. These are expensive procedures. So it's difficult to just go across the board and say, oh, the price for this is X amount of dollars. Because the day I do that, the minute I do that, somebody's going to call and say, you said the price was this, and why is mine higher? Well, you need more stuff, right? So we have this weird spot to be in. But it's pretty safe to say that on average, most people spend about $50,000. I can say that in our office, the actual average is a little bit less than that, right? It's a little bit less than that. But there's some patients that it's more than that. There's some patients, they spend more. An interesting thing happened just this last week. We did somebody's surgery. The guy was like, he's blown away because he was quoted almost $90,000 for an all-on-X. And he's like, how did I come here, get 3-on-6, get FP1, and it was so much less money? So oftentimes the 3-on-6 can be less than what people are getting quoted out there for what you don't want, like an all-on-X. But I also get the other side of the coin. People all the time are like, how do you expect people to have money like that laying around? I can tell you right now, I agree with you. It is super expensive. The cost to do this, for example, we include sedation, right? We're a flat fee. Sedation is super expensive, you guys. And they bill in per hour in 15-minute increments. So it's not like we can be like, oh, well, sedation costs $1,000. Guys, sedation costs $4,000 to $8,000 per patient. It is super duper expensive to have a patient sedated.
Because it's for your comfort.
Yeah, it's for the patient. And that's a variable we don't know. Just the lab fee alone for zirconia bridges are $5,000, if not more. So it is super duper expensive. So when people, I see them talking all the time. And
it's definitely more than that.
Yeah, no. In these groups, they're like, hey, who just has this kind of money lying around? Most of our patients finance, some are part of it, right?
Yeah.
We do have a lot of patients just write a check for it, but a lot of patients finance it. So there are options for you, but at the end of the day, you have to remember this is a really high-end treatment. This is not just your average, hey, I'm going to go to the office and get this paid for. This is not your most effective. This is not the cheapest. This is a premium type service. It's a premium treatment that, frankly, it's expensive. I agree with you. There's no way around that. So
Valeria_5588, you were asking about financing. We just saw it. So yes, funny. We do offer lots of financing options. We have some that even help people with a little bit of a lower credit.
Wait, what is the credit? Let's just talk about it. What is a low credit score that we're able to get financed?
The lowest I've seen was honestly probably 590. That was a partial.
Yeah, they didn't finance the whole thing, though. They financed just a little bit.
Thing. But if you're wanting, that's why I'm saying we have multiple options. Okay. It depends what option you're looking for. So if you have somebody down and you just need a little bit, we have an option for as low as 590. Usually they don't like to get any lower than that. But typically, if you're wanting to use someone like Proceed, who is the best company we work for right now, they offer great rates. They tend to approve you if you can hit 650 credit score. And then it's about, they look at about 45,000 per arch in income. So people that want to do 2 arches, typically the husband and the wife will apply, or them and their friend. If you're not meeting that criteria, you can always add your household income. You know, if you have questions about that, give us a call. I'll break it down even more because it's depends on each person.
So as a guideline, I think it's safe to say a 680 credit score. I mean, we've seen 650s, but 680 or above. And it's safe to say you need to make $50,000 per year.
I think 650 and 45,000 a year per arch.
Okay, there you go.
Per arch.
So yeah, there's some great financing options. What's the lowest rate? Somebody's going to ask, well, what's the interest rate?
The lowest one I saw was 5.99, which is actually really good for the economy right now. But
okay,
I've seen them.
What's the highest?
Those are for my bad credit people. They end up getting somewhere in between 19 up to 20%.
Okay. So the big difference there, depending on your credit score, depending on income, depending on all that stuff. So yeah, good question. Okay. So where did I got lost? Oh, cost. Anyway, I hope I covered it. You can kind of look in that ballpark somewhere, and yeah, it's expensive. So that's why I was going to have you cover the other half of cost, is because you're going to talk about financing.
Yeah,
okay.
It's okay. You took over.
I'm sorry.
By the way, guys, this is a very real, like, what happens in the office. He's like, you're going to do half of it. And then
I talk too
much.
He's
just so good on camera. He's like, everybody look at me. I'm just kidding.
Whatever. I just talk too much. Okay. I'm going to zip it. Okay. What was the third question?
It was insurance.
Oh, insurance. Watch me zip it. I know nothing about this. So Daisy, talk about insurance.
So insurance. Oh, insurance, how we love insurance. So insurance for this procedure doesn't typically cover a lot. Most people's dental insurance covers maybe, if anything, anywhere between $1,000 to $3,000. Now there's those rare people that have some $6,000 to $10,000 maximum. Good for you. I don't know where you got your insurance from.
But those are super uncommon.
I've never seen one.
We've never even seen one.
I have people tell me about them.
Yeah, but we have $2,000 and $3,000 yearly maximums. We see all the time.
They tend to not cover anything for this procedure because they're considering it cosmetic. Now, I know you may say, I'm struggling to live my life every day. I can't eat my food. I have to take out my denture. Insurances don't really care about that. So we've removed that from our office specifically because we can give you a master bill, because we don't want you to get caught up in, oh, the insurance is going to cover $2,000. Because most of the time we used to bill insurance and they didn't even pay. I'd go out of my way to bill it for them and they wouldn't pay it. Now, like I said, you might have it cover a couple extractions here and there, but it's considered cosmetic. So we say just don't use your insurance. If you want a master bill, we'd be happy to give you one and we'll help you bill it to your insurance. But it's really not that good. Think about it. $1,500, $50,000. Why even go through the trouble of it? So
yeah. And we've gone as far as in certain circumstances, just discounting our services down to help offset the cost. I know you don't want me to say that publicly. Sorry. We have, though. This is just us being true. Because
yeah, if you're really concerned about insurance, come and talk to us. Most of the time we'll be like, what can we do to help you feel more comfortable to not use your insurance? Because I promise you, we'll probably give you a better deal than billing your insurance.
Yeah. And the times we've tried for somebody, we'll bill their insurance. 6 months later, we're still fighting with an insurance company, or we're trying to collect $900 on this procedure. And it's taken my staff hours on the phone and all this paperwork. And at the end of the day,
staff is mean.
At the end of the day, the relationship between an insurance company and the patient, it's between them. It's not between us and the insurance company. So by providing the patient a master bill, they can submit it to their insurance company. When they call, they'll actually talk to them, and then they can just write them a check back for what their benefit would have been, right? So at the end of the day, you can still get your same value that you would have gotten out of your insurance company.
Yeah, we try to set them up for success. Insurances don't like dental offices because we're asking them for money, but they'll speak to the patients because either you or your company that you work for is paying them to help you.
Yeah, that's a good point. Hey, real quick, how many times have you seen a patient receive a dental grant?
Never.
Guys,
I have people that call me all the time asking about dental grants, and I tell them, if you find one and you know how they even work or how the office can get set up for them, let me know. No one's ever called me back. No one's ever told me they got one.
I have no idea who's benefiting from providing this false information. If there were a dental grant that paid for anything, don't you think that every All on X office, every 3 on 6 office, every full mouth rehab office, we would all know what they are? I have never once ever seen a dental grant. And it always is, oh, my friend got it. Oh, I heard of it. Oh, somebody else got it. And we ask them, great, get us the information. We've never seen a successful one. So in my opinion, do dental grants even exist?
I'm sure they do.
I don't know. I've never seen one.
I feel like they're like a myth.
They're totally a myth. I've never seen one. They
like
don't
everybody
exist.
talks about them, but no one's ever seen them. No one's ever touched one.
It's
No
always
one's ever
my
actually.
friend, I know a guy, I know a girl, I know a person that got it. No, you don't, because we've never even heard of one. So, okay. That was the 3 questions that you always, that's the 3 things you get the most.
Mhm.
We just had somebody ask a question, so I'm going to address their question.
Okay.
Then I have another one for you.
Okay.
So, how do you know how long you will be asleep? Do you just guess? Kind of just guess. Listen, we know on average how long the procedure takes, but at the end of the day, so let me start off with sedation. There's a question all the time. So this is a cosmetic procedure. If we go to put you to sleep for a elective cosmetic procedure and today's not your day to be sedated, we just would stop. It's never happened, but we would just stop. This has got to be like everything's going awesome and it's your great day to be sedated. So if for some reason, if you're in a car accident, you go to the hospital and you have to have surgery, like you're going into surgery no matter what. Here, that's not the case. So it's an elective procedure. We're really cautious about making sure that you're going to have a wonderful experience being sedated. But then the next question is, how long does it take? I don't know. I can tell you on average, a full mouth, my surgical time is about 6.5 or 7 hours, right? You tack on 30 to 45 minutes of sedation to be intubated, and then 30 to 45 kind of waking up. But surgical time kind of in that 6.5, 7 hour range. But I had a case recently that took almost 10 hours. One of my good friends that does 3 on 6, a very talented provider, recently had a case that took 11 hours. Because at the end of the day, what do we want? We want the very best outcome for the patient. And every patient's situation is different. Some patients need sinus exposure repair. They need extensive bone grafting. They have infection. They need soft tissue management. Every case can present some complications. And so my commitment to my patients is not a time frame. I'm not saying, oh, we're going to get you in and get you out in 5 hours. I'm not in a rush. I'm going to get you in and I'm going to give you everything that you need to have the best chance at the most successful outcome. So I'm not hung up on how long it's going to take. I'm hung up on what the outcome is going to be. So the other cool part about being sedated in this situation is after the beginning, we're kind of waking you up anyway. I want you to go home. So ultimately, as soon as we get done with all of this extractions and the implants and all the real stimulating stuff, we're already gradually kind of waking you up. Patients that wake up from this procedure, they'll say, oh, I don't wake up very good. I've been sedated before and I get real sick, or I have, I wake up and I really have a hard time waking up. We just don't see that here because we're just gradually, slowly waking you up towards the end of the procedure. So you're ready to go home. We tell them you might hear the radio. You might hear our dumb jokes. You might hear us talking towards the end. That's all totally normal. But yeah, I don't know how long it's going to take. I can tell on average, it's about that long. Now you have to manage the expectations at the front desk because while the patient's asleep, Daisy, you're calling their significant other or their person and giving them updates. Is that frustrating when you don't know?
No, I think it's more frustrating for the patient's rides, whether it's the wife or the friend, because it's not black and white. It's going to be this long. Actually, probably 95% of the time, if they ask me how long it's going to be, and I say it usually takes X, it'll take longer than that.
Yeah.
And he has an average, like usually it's somewhere between 7 and 8 hours. But there's some patients that take a little bit longer. There's patients that have different cases, like how he was explaining. It just depends on a couple of factors. But I have to tell them, like, hey, he's going to take care of them. He's going to do everything he can to get the perfect smile. So if he has to take an extra hour, it's okay. We promise to let you know what's going on. So probably text or call the patients right about every 2 hours.
I was gonna say, how often are you talking
Probably
to that
about
person?
every 2 hours. And then
And what do you say on that call?
I let them know when they're fully sedated, like when they've been intubated and their vitals are good and you guys start surgery. I say, hey, they handled sedation really well. They're getting started with surgery now. Then the next time I check for the lower teeth, because you usually start there.
Yeah.
I say, hey, all the implants are in, they're working on the teeth. Now they're working on the top and everything's in. So I kind of just vaguely, I know there's a lot more clinical stuff that goes into it, try to explain to them what's going on so they actually understand exactly what the patient is dealing with.
So the whole time their patient's in the chair with me in the back, and with Tiffany and with the anesthesia provider, you're giving updates to their person. Hey, this is what's going on. And then you tell them, hey, it's time to head back over to the office.
I give everyone at least an hour notice, because in Vegas, you can get anywhere in an hour. Like an hour is more than enough time to get to us.
That's a good point.
It should be.
Yeah.
That doesn't mean people get there on time. Just saying, but
they should.
They should.
They could, I guess. Okay, cool. So let's talk about our patients who come to see us from not in Las Vegas. We're based in Las Vegas. That's obvious by now. But what percentage of our patients would you just guess live in Las Vegas?
Probably about 50% of our patients live in Las Vegas or in the surrounding areas.
So that means 50% of our patients fly in to see us. Okay. Now,
that was actually one of the other questions that people ask me a lot, is that other 50% that are from out of state are, how many visits does it take?
Okay, let's talk about it.
But that's like that other specific 50% of people.
Yeah. So let's break it down. Patient not from Las Vegas. So somebody, let's just say Texas. I don't know. Somebody's flying in to see us from Texas. How many visits does that take to get all the way through beginning to end? Look at her counting. She's got to figure it out.
If their case goes perfect by the book.
Yeah, perfect by the book.
It should be a total of 4 visits.
Okay.
And they could break it down differently. They could break it down to 3 if they want to stay longer, but travel-wise, it would be a total of 4 visits.
That's correct. So let's talk about visit number 1. What's visit number 1?
It's the in-person consultation and the smile design session.
Perfect. Now, theoretically, they could stay here a few days, call that 1 visit, and then go right into surgery. So it's still 1 visit. But most people come out, smile design session, consultation, fly home.
Yep, because flights to Las Vegas typically are pretty cheap.
Well, that one guy flew in just barely for like $74.
Yeah. So I mean,
was here for
backpack only, to be fair, but yeah, you can get.
Well, they're only here for 4 hours.
Yeah, you can get super cheap tickets.
Okay.
So the reason why most people just fly in for that appointment and don't stay, it's because it's so quick.
Yeah.
They're like, I can go back to work. I'll be back.
You've only got to be at
in
the
2
office
weeks.
with me for 2 hours, and you can just see us in the afternoon. Fly over here after lunch, have the appointment, fly back home that night, right? Okay.
Yeah. With out-of-state patients, literally that is the number one thing I have to discuss over the phone, is they want to understand how it is just 4 visits and what is each visit. And so.
All right. So that was number 1. Visit number 2, surgery. We do a surgery on what days?
Wednesdays. We wear pink on, no.
Yeah. So what day should they fly in?
They should fly in on Tuesday.
Fly in Tuesday.
And they could fly in sooner if they wanted to and had nothing to do.
That's a good point. Because what time do they have to be at the office for their surgery that morning?
6:30 a.m.
Pretty early. So you really can't fly in that morning. You don't want to rely on that. So you fly in Tuesday night. Now, if a patient already has somewhere to stay, like our surgery this week, I can't say their name or call them out, but they flew in from another state, but they had a timeshare that they could use. So they already had a place to stay. If they don't already have a place to stay, where do you recommend they stay?
I recommend they call us, because we have corporate rates with a Best Western around here. It's not a casino. I know everything around here is a casino.
But let's talk about why this makes sense.
So that's what I was getting into. So the reason why we have the specific hotel that we use is because there's free parking, and you can park yourself, go straight into the building. They offer breakfast. Casinos, you have to have the casino fee, the resort fee. Also, they're usually further from our office, and the one that we pick is usually 10.
It's less than 10 minutes away.
10 minutes away.
Okay, but here's the cool part. If you have not just had oral surgery, walking through a casino and taking an elevator up to your room, no big deal. If you had just had oral surgery, you want to park your car and walk 30 feet into the hotel and then walk 30 feet down the hall to your room. That's why we like the Best Western, is because they can literally park and walk in the right inside the room.
Also, a little story behind that. Everyone that works at All Out Dental has stayed at this hotel before.
Oh yeah, like 200
We
nights.
know everybody that works there, and they know when one of our patients is there, we tell them to treat them just as good as they treat us.
Yeah, they take great care of them. Okay, so our patient this week, they had a timeshare. I got a text from the patient. So first off, they went to leave the office and we're like, well, I think it'd be a good idea if you took the wheelchair, because if you have to push your patient, like there's no way they want to walk all the way through this whole big casino and get to their room. She's like, okay, that's probably a smart idea. So they take the wheelchair. They were on the 35th floor. It took them almost
Is that the floor that they were
yes,
on?
It took like 20 something minutes to park and walk to their actual room. So maybe just stay at the Best Western. Okay, so they fly in Tuesday night. They stay at a hotel, probably the Best Western. They come in for surgery Wednesday morning. They're there on site by 6:30.
Mm-hmm.
Now, we do surgery all day. We've talked about how long that takes. We get surgery finished. They come pick them up. They take them back to the hotel room.
Yep.
And then I have to see them the next day.
Yep.
So I see the patient the next day for 30, 45 minutes, sometimes an hour. I talk a lot.
It's usually an hour.
Okay, so I see him for an hour the next day.
But that treatment time is probably only like 30 minutes.
Okay, that's
he just
fair.
likes to educate everyone and make sure they know exactly what's going on. So that takes a little bit longer.
Yeah, that's true.
That's good for you guys.
Yeah, right. So you spend some time with me on Thursday morning. Usually you have them come over like 11. I think that's nice because they can
sleep in a little bit. Yeah.
So they come into the office at 11 for their post-op appointment. Now, most people drive or fly home.
Mm-hmm.
That's it, right?
Mm-hmm.
When do they need to see me again?
3 to 4 months from that day.
Yeah, that's right. So most patients, they come in for their post-op and they get in the car and drive home, or they go back to the airport and they fly back home that day and they're home for the weekend. And that way you're kind of recovering in your own home, your own bed, kind of where you want to be. Let's just for fun talk about the patient we saw yesterday. Today's Friday. Yesterday.
Okay.
He had surgery the day before, full mouth, upper, lower, 3-on-6. How was he doing at his Thursday appointment?
He was doing good. He's like, I feel like some discomfort, and he felt some puffiness here. It only looked like he had gotten Botox. So I was like, it just makes you look younger anyways. But he said it was not anything that he wasn't expecting. He said for having major surgery, he was actually doing really good, which is crazy that we have a ton of patients who are just doing great.
Yeah.
We have just very little group of patients who.
Very few come in to see us the next day like, oh my gosh, I'm so sore. Most patients come in like, I feel great. And this guy felt great.
Mm-hmm.
He's talking, he's walking, he was going to go drive. They went and drove somewhere and got lunch. Like he's out and about doing stuff after major surgery. To expect to fly home or drive home is totally realistic.
Mm-hmm.
Agreed?
Yeah.
Okay. Totally realistic. Let's see. Did we answer that question? I think we answered those questions. I can't answer those ones.
There's no more.
Those are for their own office.
All of them.
Oh, thank you. Okay. So let's talk about your favorite part of your job at the front desk. Then we're going to talk about what you hate or what is the least favorite part. But let's start with your favorite.
I think somebody's calling me.
No, like we should talk about it. I think it's fun to know. So from your perspective at the front desk, what's the best part of working with 3-on-6 patients?
Is getting to know all of our patients. I know a lot of people work at the front and it's just a job for them. For me, it's my entire life. Like I don't want to do anything else. I like to meet these people that have lived so much life and have their stories. Everyone's story is different. It just reminds you like you can see someone with a beautiful smile every day, but you don't know what they're living through. So I'm here to be that neutral person. Like I'm not going to be like, what do you want today? Because the gas station attendant can do that for you. And everyone else does it. I don't need to. I'm here to be nice because I want to be treated nice and everyone has a bad day. So let me make your day better.
Okay, that's good. And patients come in and I don't know how this happens. Within 5 minutes, they've told Daisy their entire life story. Like she just gets that out of people so fast. And
That's so true.
they literally like we're like,
Sometimes
okay,
we're crying up at the front
yeah,
desk.
that's what I was gonna say.
I'm like, this is free therapy for both of us?
I'm like, it's time for their appointment, and they're like, oh well, they're still at the front desk with Daisy talking, and they're crying. And I'm like, how are we making them cry already? We haven't done anything, but it's because you're connecting with people on a different level.
And I guess I've also talked to them on the phone. I've been their like first point of contact if it wasn't Amelia.
Oh, that's a good point.
They're telling me very vulnerable things in their life because your mouth is a vulnerable thing. I don't think people think about it that way. If you smile all the time, you're not the person that gets concerned about it. But everyone else that hates their smile, they don't want to talk about it. They don't want to talk about why it got that way, why they didn't take care of it, why somebody else didn't take care of it for them. So to already get to that place, we're already homies by the time they get into the office. And I tell them, you're calling the right place. This is not where we're going to judge you. We are here to help you. We know that what you're dealing with or part of what you're dealing with, and we're here for that very reason. It's not news to us that you either got hit with the baseball when you were a kid and you hate your life for it and you want new teeth because of it. We hear insane stories every day. So tell me your story. We'll help you. That's what we're here for. That's what he went to school for.
Just poke me in the head so hard.
I'll
be all right.
I'm the one that gets you to tell your story because that's how you're going to come into the office. You need to feel comfortable. And I am comfy and I'm okay to listen to it. So call me.
You do really, really good at that.
And I support people that have like high anxiety.
Let's talk about that.
Yeah.
Okay. So I'm just going to go on a limb here and say 50% of my patients have dental phobia of some level. Some are so severe, like they're shaking sitting in the office.
And most of the time you don't even know until I tell you that day that I've been calling them.
I know. You have to tell me, like, this is a very dental phobic patient because I haven't met him before.
And then when you meet him, you know.
So what do you do? I can tell you what I do I can tell you what I do in the back, but what do you do in the front for a dental phobic patient?
I ask them what they need. So everyone's different, just like we all have different tastes in clothes and personalities. Some people want more info. I ask, are you the person that wants to know more, or do you just want the general gist of what we're doing? Mm-hmm. Some people get scared if you're telling them too much information. They want to run instead. So I ask them, what is the best way to help you? Is it scare you because you've had experiences, or is it a front desk thing? Like, I try to get to the bottom of why they don't want to come to the dental office. Is it a previous experience? Is it a parental, like whatever it is? And then I support them. So if somebody is like, I hate it so bad, I don't want you to tell me anything about it. And I also need you to call me 2 times before the appointment because I need to convince myself that this is what I need. That's what I'll do. If they tell me, don't talk to me, leave me alone until my appointment, that's what I do. And sometimes they'll come in and they'll tell me, I'm so nervous. I can't believe I even came here. You can hear them shaking because they got into the office. Then I ask them, what kind of music do you like? Let's set the vibe. Let's put some spa music. Let's relax you. Let's play something on the TV that's calming. You want some EDM music? We'll play EDM music. We'll make it a party. So I'm like what are those things that morph into everything and anything?
I don't have any idea.
That's who I am.
You're a daisy.
Yeah, I'm a daisy.
Okay, so 2 things that you hit on. So it's so powerful that you take space and ask the patient, what is it that we can do for you? How do we help you have a better experience? So that's really important. But number 2, we have the space to do that because we're not a high production office. We can actually give every patient that personal attention. You can actually spend the time with them at the front desk with just them in the office because we don't have patients scheduled all day long.
And it really, yes, I can't say the words right. I keep going. Sorry.
That's okay. So we have the ability to spend the time with the patient to make them feel comfortable. And essentially that's all I do in the back. I just say hi, and I kind of meet them where they are. People that are really high energy, I'm like, hey, let's have some energy. But you can tell the people that are really timid and scared to be there, and we meet them where they are. So you've already conveyed to either myself and or Tiffany. Tiffany's already talked to them, and she gets me and says, hey, just so you know, this patient had a bad experience in dentistry, or this patient is nervous to be here because of this. So when I come in the room, I'm not coming in saying, okay, you're here today, let's get going. I meet them where they are. Hi,
Yes.
I'm proud of you for coming in today.
For example, you're going to remember this story. He was not like high anxiety, but he did not like the dentist because of his previous experience. He came to the office saying, I don't even think I need this consult. I'm probably not a
I
candidate.
do know what you're talking about.
Was ready to be told no.
Yeah.
He's like, I don't even want to do the paperwork. So
I don't want to fill out my health history because I'm just going to be told no.
So I said, okay, let me see what's the minimum amount of things that I can have you do and get you back to talk to Dr. Emmett. And he actually is such a fantastic patient. He's been done with treatment probably for almost maybe over 6 months, a year now.
Yeah.
But it took me listening to him saying, I've been to offices. I've been feeling like I've been treated like crap. I don't want to do this again. He did not want to do this. He was so adamant, like, I'm not a candidate. I'm not going to do this. He came out a whole different person because I told him, hey, we're not going to do all the same stuff we do. This is a very specific thing. And that brings a good point, how we're different than what everyone else does. Yeah, you get to keep your gums, but what else do you get? You get custom service. You don't get just custom teeth. You don't just get custom smile. You get custom me. You get what you need. You get custom Dr. Emmett based off of your needs. It's very custom to you. It's not cookie cutter. We don't treat every single person the same because not every person is the same. So everything is special for you.
And at our office, we don't do anything besides 3-on-6. So if a patient called the office today and said, hey, could I get in for a single implant? What would you tell them?
I'm sorry, but we actually only do full mouth rehab at our office.
Guys, it's all we do. At All Out Dental, it's all we do. That's all we do is 3-on-6. That's it. So the entire team eat, breathe, sleeps, thinks 3-on-6 all day long. And that means that everybody who's in that waiting room, everybody who has an appointment, everybody who's coming over is all there for the same thing.
Yeah.
And it's not very often that we have patients cross paths in the waiting room. It just doesn't happen that often because we schedule copious amounts of time for every patient to get all the time they need. So average time between when a patient arrives at my office and when they're back with either Tiffany or myself, how long is that? If you had to guess, from when they walk in the door to when they're actually back in the office being treated.
If they did their paperwork, they probably blink and you guys are walking out.
Yeah.
But yeah, no more than 5 minutes.
Yeah. This is not like I'm going to go to the doctor's office and sit there and wait for 30 minutes for my turn. It's so frustrating for me to go to doctor's offices for my own appointments.
We're so picky because we know how people should be treated. Don't yell my name from the door. I'm a human. Say, hey, Daisy, how are you?
Right.
Let's come and talk.
But that's when we walk out there, there's one person in the waiting room. Like, we know what you're here for. So, but it is fun when they do overlap sometimes. Like when a patient's leaving and they just got their 3-on-6 and somebody's there about to get there. Isn't that kind of a fun thing to watch?
We had a patient recently, had surgery, and there was another patient who had surgery the week before. And she's like, oh my gosh, let me see your teeth. Can I look at your mouth? And I think they actually were holding each other's faces, just like smiling at each other.
Teeth.
And sometimes those moments are great. So rare on occasion, they do bump into each other. But it's probably because he's just telling someone extra information so that they're more comfortable.
Talking too much. I'm sure that's what it is. So yeah, listen, it's more of it's people ask me what type of office I have, and the best word I can use to describe it is boutique. I don't really know what that means, but it is just very specific to only 3-on-6. And we are not slamming patients in all day, every day. We're not double booked. We're not trying to get through appointments as quick as possible. My goal is to give every patient the time they need. So we have to block time for that. Sometimes we get done with an appointment. We're like, wow, that went really fast. What are we going to do with this extra 25 minutes? But sometimes the patient needs those 25 minutes. Sometimes they need 45 more minutes. Sometimes they need that little extra confidence in holding their hand and explaining things. And it's not even that they needed that so that they could decide to do surgery. Sometimes they need that to go home and decide that they don't need this, or they need that time to go home and make the best decision for them. But my goal is to overeducate, right? Tiffany's same thing. Give them all the information that they need to make a good decision for themselves. And listen, we're terrible salespeople. Like, we're not very good. We're not selling used cars. There's no pressure. We've never once said to a patient, no, you got to make a decision today, or you have to do this now, or there's not another option. Hey, here's your options based on what's happening in your mouth. This is a judgment-free zone. and here's a solution that we think would be great for you. We'd love to help you get there, but it's ultimately your decision, right?
Mhm.
So that takes some time for everybody. Was there another question? I saw something pop up down here, but maybe it wasn't a question. Okay, perfect.
No, they just were waving on it.
Okay.
There's one.
Oh, wait, I see it.
Oh, we have a question. Let's see what it is.
If I had 4 terribly bad teeth, should I consider full mouth restoration?
If I had 4 terribly bad teeth, should I consider full mouth restoration? Probably not. I mean, 4 terribly bad teeth could be the start of something. It could be a hint that there's more going on. I don't even know what the word terribly means. I can make some assumptions. But listen, full mouth rehabilitation is a very extensive procedure, no matter how you look at it. So even though this is really minimal bone removal, really conservative approach, it's still a major surgery. It's all of your teeth being removed and replaced with implants. And the facts are that implants are never going to be as good as your normal teeth. But at some point, if your teeth have failed you and you're having failing dentition, you have terminal dentition, this is the best option for a lot of people. But when you come in for a consultation, we look at all of that. And I tell plenty of people, hey, it's not right. When you come in the office, anybody who's come to see me knows this, but I say, I have 2 goals today. Number 1, I want to determine if you're a candidate for the treatment that I do. But number 2 is, even if you are a candidate, is this the right treatment for you? Because they may not go together.
And I get that question on the phone too, is like, what if this isn't the right treatment for me? Like, they think that you're going to make them get it. And I try to tell him, he's conservative. He will tell you to keep your teeth if that's what you should do.
I have a lot of people who come in for a consultation and I send them out and say, guess what? There's a more conservative option. There's a less invasive option. Here's the things I want you to go consider first. We have a lot of patients that they're not a candidate for 3-on-6 because they just don't need a 3-on-6. So yeah, if you have 4 terrible teeth, does that mean you're ready for full mouth rehab? Not necessarily. That's a time where you just come in and get a free consultation. There's 0 risk.
Mm-hmm.
Find out. Come in, take an x-ray. Let's talk about your x-ray. Let's talk about what's going on in your mouth. And let's explore every option you have. I think that's another unique thing about my office. And big shout out to Tiffany for this, because she sits every patient down and says, here are all of your options. Let's talk about dentures. Let's talk about partials. Let's talk about all on X. And then let's talk about 3-on-6. So let's talk about everything else that you might have or be a candidate for that's more conservative, or even just crown and bridge and fillings, right? Does this patient, could they accomplish their goals with just doing crowns? Would bridges, just normal bridges, be okay? Would fillings be okay? We want to make sure that we're doing the right thing for you. And sometimes I think in our industry, maybe every industry, there's maybe offices that are pushing everybody towards something. There's this old adage, if you're holding a hammer, everything looks like a nail. So if you have a full mouth office, everybody needs full mouth. That's not the case at my office. So we only are going to recommend exactly what I think is in the best interest of every patient.
I love that. And we're kind of starting to get short on time. So I just wanted to like wrap up a little bit of what the whole experience is when you contact our office. There's people like him that say, do I need this? We have tons of people that fill out forms on our website all the time, just wanting to get a consultation with Dr. Emmett. Amelia will give you a phone call. If you don't answer, she'll shoot you a text. You can talk to her about your problems, tell her what's going on. She will help you decide, like, hey, I was told I only have one problem with tooth. Come on in, talk to Dr. Emmett. We'll check it out. The next time you call, you'll talk to me. Then you'll meet Tiffany. She'll educate you. We're just educators, really. Every step is just more education so you feel more comfortable by the time you get to Dr. Emmett. And then that's all 4 of us.
Yeah,
that's
how many people work there?
You've met half of us.
There's half of our whole team.
So that's why I wanted to explain. It's Amelia. She is that first one that you get to hear from when you fill out a form or call our office. If it's not me, I'm the face that you see at the front. I'm the one that you get to talk to when you're making your appointments. Tiffany is the one that you get to talk to about your treatment options. Dr. Emmett is the one that tells you, I can do it or I can't do it. And then we're just all a team here to help you with your smile journey, whether it's today or whether you say, hey, I have to come back 3 months from now when I get more financially situated. We're still going to be there. We're not going anywhere. 4 years, he's stuck with me.
Okay, so I know we've only got 4 minutes left, but I'm going to bring up one of my favorite things that happens at my office. I can be in the back of my office and I can hear every time the door opens or closes, we have this little alarm system that makes a little chirp sound in the back. So I know the door opened, but instantaneously I hear my front desk staff call a patient by name. Hi, so-and-so. Oh my gosh, it's great to see you today. How are you today? Because every patient who comes in that door, even if it's for a consultation, we know their name.
Mhm.
How do you do that?
I don't know. Somebody asked me that the other day. It was me and actually Amelie were trying to move the schedule because you were taking a little bit longer with someone. And she said, "Can we move them?" I said, "No, they have an appointment at 2:00 with their kids, so they can't make it to here." And all I can say is it's going to sound like the most BS answer. I just care. I care about the people. Like, I know what they're going through. I know that this is already a hard experience. So myself, I'm like, what can I do to make their life easier? They become part of the family, and I start remembering little things about them.
And I love that we know our patients. When you walk through the door, you're greeted by name because we know you. This is all we do. Even if you came in for a consultation, this time was blocked out for you on the schedule. They're not going to have you walk in and say, sign the intake form, have a seat, and then somebody come out and say, Jason, right? There's 10 people in the waiting room. You walk in, you say, hi, Jason. Oh my gosh, we've been waiting for you. We're so excited you're here today. It's just a totally different experience. So I'm always love that when I'm in the back of the office and I hear that happening up front. So thank you. Miss Daisy, thank you so much for joining me on this live today. I love that people got to meet you, get to know you a little bit, hear a little bit about your passion for what we do and caring for patients. And I just want to make sure to tell you that I love that my pursuit of patient excellence and excellent care for patients is yours is equal to mine. I love that from the very front of my office to the back of the office, they get that same genuine experience from somebody. So thank you. Thanks for being so genuine for our patients.
Pinky promises are really important to me. So
yeah, pinky promises in my office are a big deal. And she made a pinky promise and I did too one day. So if you are interested in full mouth, if you are considering having implants, maybe you've talked to Nuvia or Clear Choice, or you're just new to 3-on-6, I encourage you to give our office a call and come in, have a consultation. Let's find out what you need. What number would they call, Daisy?
702-710-9006.
Again, call today, 702. No, it's not that bad.
9006.
So anyway.
Thank you guys for everyone who joined. I know that we're going to be more consistent about it moving forward. We're going to be doing these every other week.
Yeah.
So tell your friends,
tell your friends,
share it with your family, anyone that you're like, hey, I think they could use this, have them join us. And we'll see you again in 2 weeks.
Yeah. Okay. Thanks, Daisy.
Bye,
thanks,
guys.
everybody. Bye. And.